So you want to learn more about how to deal with these behavioral challenges with a child with autism. But you kind of want to still have them have their way. You know, they ask you for something, you feel kind of bad, you're dealing with your own guilt of, yes, they're diagnosed, yes, they may be looked at differently, oh my goodness, the world is going to treat them different. So all of a sudden, here you are giving in to whatever they want. Hi everyone, my name is Dr. Alisha Griffith. You most refer to me as Dr. Ali, and I'm your autism parenting expert. Author of Amazing Gift, A Journey to Autism Acceptance, audiologist, speech-language pathologist, and educator for over close to 20 years. Today I'm going to share with you one major tip that you have to learn to use immediately if you want to have more structure in your home. That main tip is going to be, what is it? Structure with follow through. If you have a guideline, if you have a rule, state it clear and follow through. If you keep breaking the rules, if you keep feeling bad, if you keep saying, well, maybe not today, if you change the structure in the routine continuously because of how you feel, you're going to see more behavioral challenges. Why? Because you let me have what I wanted the last time. Why aren't you doing it now? That's what they're saying when they respond. Or they're saying, I'm angry, and you have not claimed authority in that conversation. See, if you start younger, if you start at the point when they're newly diagnosed, if you start at the point when they have more ability to listen, then you'll be able to implement these strategies and tools immediately, using more visual cues, using an authoritative voice, with staying within your constraints. You let them know, I am mom, this is what it is, there is no option with this choice. You also have to know when there are times to provide choices. However, the key is, how do they respond? How are the immediate responses when things are not going their way? If their response is to hit, if their response is to bite, if their response is to scream, then that's not the response that you want. So now it's time to start changing things around. Now it's time to regain authority in the situation. Yes, write it down. I am the authority in this, or authoritative person in this situation. You got to be able to write it down, and you got to be able to say it. The second thing you have to be able is to create structure. Once you create structure, you got to follow through. You can't keep stretching and bending and feeling bad and then changing things, because if you keep changing things, they're just going to look at you and say, oh, they're not serious. They don't really mean this. And the last thing you want to do is communicate through the process. You have to let them know this is what happened, and as a result of this, it'll be this consequence. A consequence can be something great, like they did exactly what you needed them to do. Give them a reward. The consequence could be, nope, they're not doing exactly what you needed them to do. So then you hold off that reward. You have a conversation. You let them know, okay, you made that choice, but I'm still letting you know that this is what needs to get done. These are just a few tools that I'm sharing with you for those that have specific information or specific behavior challenges, or just that communication in which I've lost complete focus of the situation and you need specific individual parenting advice or expertise or a coach throughout this setting. Make sure you reach out to bit.ly/chat and create, and we can sit down and spend a few minutes, just 15 minutes, getting something incorporated into your home. It's time to take back that reign and give it tough love. Stop feeling the guilt and letting them do what they want. Why? If you continue that way, it will lead into bigger problems and bigger challenges later down the road. It's your girl, Dr. Ali. I am your autism parenting expert and mom of Zachary, and I love sharing with you. Have a great day.